Seeing no other questions, I want to thank all the panelists. At this time, we're going to move to public comment. I don't anticipate a lot. I mean, the crowd's moderate, but if we can try to keep our comments brief but what we can do is we'll start off with public comment. Anyway, thank you. And please state your name, if you represent an association or an entity, and then.
Yeah, I actually didn't expect to be first, but Marty Yamoto, California Disability Senior Community Action Network. My older sister had developmental disability. She passed away, but I'm still active in this system, in the community system. Just want to say that I hope that the legislature, both Republicans and Democrats, come together on the importance of finding a solution to the managed care organization tax. It's so important because that funding makes other things possible, and it makes, hopefully, if it's done right, the continued restoration of the in-home supportive services restoration that will continue beyond next year. Got to remember, people with developmental disabilities need and depend on IHSS too. Lastly, I just want to urge both Republicans and Democrats, the legislature, the Brown administration, and also all of us as advocates, that we all come together and try to find the solutions towards funding the critical services that our community needs. That includes targeted more funding for regional center services, including the providers, but also those that impact the children and families in the community. And also for the fee-for-service Medi-Cal providers who our community depends on. And lastly, let us not forget the other needs that our community depends on. People with developmental disabilities also need SSI, SSP. They also need mental health services. Many depend on CalWORKs. Let's not forget that those needs are important too. And thank you.
Thank you. My name is Anthony Wright. I'm the Executive Director of Health Access California, the statewide healthcare consumer advocacy coalition. We very much appreciate this presentation. We are supportive of these efforts to revamp the MCO tax so we do not have a hole in our Medi-Cal budget. And I think it was a very good presentation to indicate the need to go further in making some key restorations to Medi-Cal rates and benefits, something that has gotten bipartisan support in the budget process earlier, and we need to find the revenues to do that as well. So both to stabilize our budget for the status quo and to go forward. We appreciate the conversation also about additional revenue options to on the specific questions of Senator Monning. We are now 35th in the nation in terms of our tobacco tax. Yesterday, 5 states raised their taxes. They included the bipartisan list of Kansas, Nevada, Louisiana, Ohio, and Vermont. And so we're 35th in the nation. We're actually 49th in the last time we updated our list. Only Missouri has not updated and modernized their tobacco tax since the last time we did it in 1999. So the time is now for that kind of investment, especially if it goes to the kinds of needs that were demonstrated today.
Good afternoon, Mr. Chair and members. I'm Bill Barnaby. I'm here on behalf of California Medical Transportation Association, as well as the DaVita Healthcare Partners. I wanted to say something on behalf of 2 groups of Medi-Cal patients. One being those Medi-Cal patients who now and in the future suffer from end-stage renal disease and need dialysis services. Without rate increases at some point, capacity will not be maintained to take care of the increasing numbers of these folks who need dialysis to stay alive while they either wait for a transplant or live out the rest of their days. And they need the medical transportation when they're medically challenged to the point where they cannot ride in a bus or car to and from their medical appointments, including dialysis. The other group I'd like to mention is this new group of Medi-Cal beneficiaries that were brought into the program by the ACA, and that is the childless, under 65 persons with less than 133% of income. Today, they can get a medical eye exam, a routine medical eye exam, and they can get a refraction prescription, but they can't get eyeglasses. So those eyeglasses, we think, would put a lot of these working age people back to work. So there's an investment there that we think would pay off. And by the way, these folks are eligible for 100% federal funding. So I think these two groups stand out and would urge your approval. And let me reiterate the support for your efforts going forward. We need to find funding sources for these, for Medi-Cal generally, and for the two groups I've mentioned. Thank you very much.
Good afternoon, Mr. Chair and members of the committee. Mary Jan, California Association of Health Facilities. I'm really here today on behalf of the state's over 1,200 intermediate care facilities. We just want to be sure, as the committee explores solutions to the developmental services system funding crisis, that we are not lost in that discussion. Intermediate care facilities serve over 7,000 regional center consumers, largely in small community-based homes. We are different, however, in terms of our funding. We are separately funded through the Medi-Cal program, and we're wholly dependent on that Medi-Cal funding to sustain operations. Thank you.
Mr. Chairman and members, Carl London here on behalf of the California Disability Services Association. I want to make just a couple of brief comments and then provide some context to some of the facts that were discussed earlier. First, I want to say that we absolutely agree with Senator Mitchell that this discussion on developmental disabilities in the service system must be reality-based, needs to be timely. Senator Leno made the point that this can't wait. We absolutely agree. Inaction for our community is going to have substantial consequences. We're already seeing it. We have providers today that, as was said, are refusing now to take people out of developmental centers because they just can't afford to do it anymore. And wanted to add that, revenues can't be the excuse. I want to point out in this and some of the LAO's comments, in particular, if you look at page 9 of their document, they talk about the fact that DC closures will require development of new community resources. Another way to look at this, however, though, is that people moving out of the developmental centers in the community will save the state money, and we have proof of that. The budget you just passed included a very clear reference to $64 million saved due to the closure of the Lanterman Developmental Center from people moving out of a developmental center into the community. $64 million was saved. We got none of that money back, and in fact, over the past 8 years, we've documented now that this system and the community-based system has saved the state of California $400 million from people moving out of developmental centers into community-based programs. We haven't received a penny of that back. The other thing I did that I wanted to point out is I just gave you a couple of charts because this speaks to a couple of the facts that were referenced by the Ledge Analyst's Office. The first is this chart that comes right out of the Department of Developmental Services on the severity of people in the service system, both inside the developmental centers and in the community. The discussion point was raised that people in developmental centers have a higher acuity, that they're more difficult, more complex. Actually, that's not factually true. If you look at the volume of people in the community in this chart, when they compare people in developmental centers versus people in the community, there is often tens, hundreds, thousands of people in the community who look just like the people in the developmental centers today, and we are serving them every single day in California. They don't need extra treatment in the community. They need appropriate funding. The other chart that I gave you is a chart that shows the number of people that have lived in developmental centers over the past 10 years. And if you look at that, any 3-year comparison of that chart and the number of people that live in developmental centers, that over a 3-year period of time, the reduction is greater than the number of people we have left in the Sonoma Developmental Center and the Fairview Developmental Center, except for one period in there. 7 out of 8 years, we've been able to move the number of people that live in developmental centers out into the community in every single 3-year cycle. So when people talk about how hard it is to close the developmental centers, to move people into the community, we've been doing this for the past 8 years. Over any 3-year cycle you want to compare, we've moved that many people into the community. This is not hard. We shouldn't make it more difficult than it is. We should do this, and we should reinvest in the community, just as been suggested. Thank you very much.
Thank you, Mr. Chair and members. Nick Luizos on behalf of the California Association of Health Plans. Some of my members pay the existing managed care organization tax. All of my members would pay any new MCO tax, or virtually all of them. So we have vested interest in this issue. In past sessions, CAP has supported a tax on Medi-Cal managed care plans that met key principles, and any new tax that would go forward would have to meet similar principles, including direct benefit to the Medi-Cal program, equity among the payers of the tax, and a consideration of affordability in the healthcare system. The revised MCO tax that was put forth in January by the administration, we felt did not achieve those principles. But to be fair to our partners in the administration, we know we're not here by an act of state policy. It's really a federal policy that is very prescriptive, that makes it exceedingly difficult to find an alternative funding source that doesn't lead to market dysfunction or huge increases for private payers of care. Fortunately, as was discussed earlier in this hearing, the federal government does give states more time to find an alternative funding source. So we continue our internal discussions. We look forward to working with the state and working with this committee on something that can achieve broad-based health plan support. Until that time, we would just emphasize thoughtfulness and caution. Thank you very much.
Evelyn Abu Hassan with Disability Rights California. We would like to thank the committee for the robust discussion today on community rate issues. As individuals with developmental disabilities move out of the DCs and into the community becomes our safety net. Just a couple of key points that we would like to make sure that we address the committee with. First of all, as Mr. Martin said, there are new home and community-based regulations that are being implemented. We want to make sure that the current rates are adjusted so that those requirements are being met. I want to talk a little bit also about the median rate cap. The median rate cap places a ceiling on providers, regardless of the cost of operations. And this essentially creates a wide disparity between the rates paid to old and to new providers for similar services. The unintended consequence of that is it penalizes providers that serve clients in geographic areas that are of high cost. And it precludes providers from providing and expanding on services that we know would work. The other couple of comments that I'd like to just highlight is I wanted to compliment Senator Motting for talking about the local minimum wage issue. Lots of local minimum wage ordinances have increased minimum wage. We need to make sure that the providers are paid enough to ensure that they're meeting their legal obligations there and not just increasing the state minimum wage. Finally, one of DRC's priorities is ensuring that people in the developmental centers, developmental disability system from diverse communities get the kind of services they need in languages that they understand. And we want to ensure that rates are addressed to ensure that we have bilingual services available to individuals with developmental disabilities in our system so that they can ensure that they have are able to communicate in a way that helps them to get the services that they need. And one of the ways to do that is looking at a possibility of bilingual differential for those kinds of services. Thank you very much.
Good afternoon, members. I'm Tom Dominguez. I'm not here representing any group in any capacity whatsoever. I am a father of a 12-year-old girl who has a developmental disability. I was here in the Capitol on other business, and when I heard about the hearing today, I felt compelled to come in and spend about 45 seconds of your time to share with you some of my thoughts. You know, as a dad with a daughter who has a developmental disability, I'm involved in the local community with other families. So I have, you know, firsthand experiences, and I've shared experiences, and they've shared experiences with me with the difficulties these families encounter when they try to access services. The number of Californians who are diagnosed with intellectual or developmental disabilities has grown exponentially over the years. Particularly in the areas of autism and related disorders. But available funding has not kept up with the demand for help. Families get frustrated. They're frustrated as they try to access a maze of ever-shrinking services. This is especially a problem for families where English is a second language. It's more acute to those families. Now that the state's budget has improved dramatically, it's time for increases. Increases in funding across the board for people with intellectual and developmental disabilities. Why? Because it's the right thing to do. The system has suffered from neglect for far too long. This legislature has the opportunity to fix the problem. Please, I ask you as a father to act now and on behalf, for not just for me, but for all of the families, especially the ones who can't be here today to speak for themselves. I think today I represent those families and those dads and those moms out there who have children who can't be here. I'd bring Isabella here to speak in front of you today, but she's in summer school, so I'm here speaking for my daughter, Isabella. Thank you.
Chairman Hernandez and members of the committee, Rick Rollins, here in two capacities. One as representative legislative advocate for ARCA, Association of Regional Center Agencies, and secondly as a father of a son with moderate to severe autism. First of all, in my role as legislative advocate for ARCA, I want to express my thanks and our thanks to Senator Bell for his leadership and the other members of the committee in the developmental disabilities community. We strongly support the Lanterman Coalition 10% increase to the system. We're very disappointed in the governor's action in not including funding this year through the general fund. And I'd like to say as a parent, I'm deeply concerned about this after we're close to the 50th anniversary of the Lanterman Act, which has been solely funded through the general fund and through federal dollars through the Medicaid and other waivers, that we're now talking about funding this program through an alternative source of funding. And I fear that if the state does not have the commitment through the general fund to support this system in going forward, that we need to absolutely be very concerned about the legacy that the legislature and particularly the governor will leave in the future of this system. Thank you.
Hi, I'm Bob Giovatti with the State Council on Developmental Disabilities. Our organization has been working on these issues for decades. It's difficult to follow the two gentlemen in front of me, but interestingly enough, most of the folks who were part of the Special Needs Army didn't volunteer. We were drafted. In my case, I have an adult son with Fragile X syndrome, and I've seen firsthand the problems, issues, and concerns related to having people come into his life from the various provider organizations and then having to leave because they couldn't get paid well enough to stay. And so it's musical chairs for my son, and many of these individuals, they need consistency, and they just see one person after another come in one door of their life and exit out the other door. We've got to start treating the folks who provide services to individuals with intellectual and developmental disabilities like a valued group of individuals and not an afterthought, not a necessary evil. They're so important to the vitality of the state of California. So I appreciate so much what many of the legislators on both sides of the aisle have done, Senator Bell and the Bell letter from earlier this year, and now the bill he just talked about. But it's so vitally important that we do something to validate these individuals, to get proper funding into the system. This is a problem that's not going away. More and more folks are being diagnosed, and we just need to take this as seriously as we possibly can and make sure that something tangible comes out of these great discussions. Thank you very much.
Hello, my name is Jackie Dillard Foss. First, I represent the California Supported Living Network, which represents 54,000 people in supported living and independent living. So when I hear the discussion around where will the people from the developmental center go, supported living is an option, continues to be an option. Senator Pan, I invite you, because somebody 4 months ago left Sonoma Developmental Center and lives in your district. He's medically fragile. He's surviving in his community, and he is there. So I would like you to meet him so we can actually put a face to the conversation, because sometimes I think we get into MCO, tax, smoking, tobacco, and we lose sight of the faces. Senator Bell, thank you for continuing to be a champion. Sometimes we hang our hats on those champions that see and feel what we're going through, so thank you. Senator Monty, keep asking those hard questions, because we're going in there and saying, yes, those are the questions our community needs answered. When we're talking about the developmental center system, I want to put in perspective. In 2003, when the rate freezes came in, my turnover rate was around 24%. 24% for our folks, which was way below the national average. This last quarter, I was going around 50%. I was talking to the Residential Coalition yesterday, and he says his turnover rate is 85%. And if you're a person with an intellectual disability and you need really private medical care and someone is bathing you and touching you and you have to extend trust, and you don't know 3 months at a time if that's a new person coming into. Sometimes, if you've ever been in the hospital, I was in the hospital experiencing for the first time someone bathing me. That is the most intimate thing can happen. And we're paying these people $10, $10.40. I hear about the minimum wage. I am all in for paying my employees more money. But it seems the state of California is not. We don't call people personal attendants. We call them direct support professionals. G-tubes, J-tubes, bathing, feeding, goals, shopping, medical appointments. The list goes on about what these professionals do. And when does the state stop ignoring what they do and start recognizing them for what they are? We see when you talk about things that happen in turnover rate, if you want to put risk, we all understand that. When someone changes a doctor, we understand the risk. You don't know the person as well. We've got to get perspective here. We got to put faces. That's why I invite you, come and meet the people. See the faces of who you are saying no to or who you are saying yes to. Get beyond politics and get back to the person. That's what I ask for you. 50% is too much. 60%, 70%, 80%. When do we say enough is enough and we stop the collapse? I want to add one more thing because the LAO did really good about vendor rates. Frozen, 2003. I heard Senator Leno talk about these state employees went for 6 years. Well, we're talking about 10, 15 years of no rate increases. So try to survive on that as a business. Workers' comp, unfunded mandates, the list goes on and on. The other part about new programs, you don't need to develop new programs. You need to fund the programs that are there. We have quality. We have exceptional programs. And you guys are starving them to death and thinking, let's reinvest in new programs. I'm telling you, you got a great bullet train. You just got to fund it. So that's all I got to say for now. I'll be back.
Good afternoon. My name is Stacy Sasson. I'm the Director of Community Resources at a local supported living agency here in Sacramento. Before that, I was an IHSS social worker and an IHSS supervisor. So I've seen both sides of things that were discussed today, and I've seen firsthand in both positions the level of support and the level of care that people receive in their own homes and how successful they can be in their own homes. I've also seen how the state of California saves millions of dollars keeping people in their own homes or serving them in their own homes when they come from developmental centers to supported living. I've seen it in my current position where we've moved people in 6 months, a year. There was concern about 3.5 years to close Sonoma. We can do that. It's not a problem. The problem is that with people not taking referrals because the community is not funded, where are they going to go? So the problem is a funding issue. It's not, can we support them because they're too medically fragile? Can we support them because they're too behaviorally intense? No, that is not the problem. We do that now. We have several thousand people in the community that we support with medically fragile G-tubes, J-tubes, whatever they have in the developmental centers. We have that times 1,000 in the community. So Senator Pan, I would also invite you to come and do a tour and see. I'd invite all of you to come and do a tour. You've all said some very nice things and things that I agree with, but things were said during the regular budget session too that were very nice, and here we are in a special session. And we can't wait anymore. We just can't. So I would just ask that you really take into consideration where we are. The crisis is real, the need is real, and we need your help. We need it now. We can't do this without you. Thank you.
Good afternoon. My name is Kim Dodd. I'm actually a constituent of Senator Bell, and I reiterate the comments about your leadership. It's deeply appreciated. As a member of the supported living vendor community in Santa Clara County, we are coping with the premium minimum wage situation. Our agency started dipping into our reserves. We opened our doors in 2002 during a budget crisis, hoping that things would get better. And we have been able to sustain over the years through a variety of methodologies, but we found that we had to dip into the reserves starting in January of this year. We couldn't afford the Affordable Care Act with frozen rates. And so that some of the realities that hit are we have reduced the number of people we can serve. We have actually not, we are not accepting any referrals from our local regional center. In fact, at our most recent monthly meeting of supported living providers in San Andreas Regional Center, we went around the room and they asked how many referrals, or are you accepting referrals? There was one agency in the room that's currently accepting referrals. So the impact is real. The impact is now. We want to provide these services, but we have to be adequately funded. Thank you very much for your time. I appreciate it.
All right, I'm short. Hi, my name is Rachel Nelson, and I'm with a service provider company in Sacramento region. I wanted to say when I first started with the company, we started employees at a higher rate, way above, minimum wage. And as the years have gone on, the years passed without a rate increase, the starting wage actually steadily decreased, and we were having a harder time providing better benefits and better starting pay because we just haven't been given a raise ourselves in 15 years. Our company and companies like ours lose great employees to better paying jobs every day to Walmart, Starbucks, McDonald's, just because we can't afford to pay them. We don't have the luxury to raise our prices to pay for the unfunded mandates. And also the talk and implementation of minimum wage increases in the surrounding counties and now in Sacramento is very scary. How will the vendors of the DDS system be able to survive? The 10% increase we were asking for is basically 0.67% increase a year in the last 15 years. So if we're asking for just that, So we're just asking to help rebuild and stabilize the once established system. Thank you.
Good afternoon. Michelle Ramirez from a social services agency here, serving about 350 clients with developmental disabilities per year, serving about 13 different counties of California. I just want to say that I find it very disheartening that our system talks about deinstitutionalization, and we fund a costly system for years, and we talk about moving people into the community, yet our community has been neglected year after year, 15 years to be exact, without a rate increase. Our system cannot bear this any further. Just using some of the numbers today, 300 vendors in 5 years. By this time next year, that will be 60 vendors, and actually, we think it will be quite a bit more. That's thousands of clients impacted. We just can't bear this. We need to have fiscal commitment this year. This needs to be the year. Thank you.
Good afternoon, Senator Hernandez and members. My name is Tony Anderson, and I'm the Executive Director of the ARC of California, also represent United Cerebral Palsy in the state, and also here as the chair of the Lanterman Coalition. The Lanterman Coalition is every organization in our community. It's a coalition that's fighting very hard. And this year, I think we made a really good effort of explaining and describing and showing to our policymakers and the rest of the community what exactly is happening in this community. And we've shown how we're at risk. And you've heard today about being at risk of losing federal funds that we have. We've talked about the conditions of not meeting our case management levels and what that means and how we could be at risk there. We also today talked about the capacity, and we're at risk with CMS because we don't have the capacity. You've heard of providers going out of business on a regular rate now, and you've heard of providers not taking new people to serve. This all reflects back to capacity. Is California really providing the capacity that we promised to do as part of the deal with CMS? So, and we would say the answer is no. We're out of compliance. All that is at risk, but also people in their lives are at risk. And our community has done a tremendous job this year, I think, and will do even more throughout this session, this special session, to make sure that everybody is aware of what is happening in the lives of people with developmental disabilities and their families. Now, we won't stop. We will continue to push on. But what we urge so strongly, and what the community will urge so strongly, is that this not be a very long process of talking. We want some real action immediately, and we'll continue to press for real action immediately. The real life conversations, critically important, but this can't continue because every day that we wait is more people not getting the services that they need, more businesses, more nonprofits in the community going out of business. So we're going to continue on our pressure and working together with our leaders here. And we've had tremendous support from the legislature throughout the year. The kinds of things that we have been retweeting and posting on our Facebook, I know you all have been readers of all of that great content that our community has been providing. But it's going to continue because we really are in a bad state. And if you're all very crunchy these days because you've got many extra hours of work to do through the special session, it's appreciated that you're putting that in. But know also that our community is very crunchy also. And you'll hear more about that throughout this session and until there's some resolution.
Laurel Mildred on behalf of California's community-based adult services programs serving over 30,000 elders and adults with severe disabilities. I'm speaking to the Medi-Cal rate issue. We have been here before speaking about closures and the urgency of the rate. We know that you heard us from the actions that the legislature took, and we're just here to reiterate that urgency and to update you that since the budget hearings occurred, during June we had yet another closure. Santa Clarita Adult Day Health Center in Los Angeles closed, and I wanted to just note that they closed with 12 days notice, and that 53 participants, some of whom had been in long-term services for years, were suddenly thrown into chaos, and their families, and they're coping with that right now. So every moment that we don't address this, we are having severe human impacts, and we are permanently losing our infrastructure of home community-based services.
Will Sanford, Executive Director of Futures Explored. I can sympathize with Senator Mitchell's comment about task forces. I am on every task force that DDS has, the Secretary has. I was at a meeting yesterday on the impact of the settings. We're also worried about what happens with the Workforce Innovation Opportunity Act when that comes into play. That's all about employment. A year ago, I noticed the state and the regional centers that I was no longer doing individual placement support employment because I cannot afford to lose $600 on every person we got a job. These people became taxpayers. These people got their own apartments. We stopped. 60 people don't have those jobs anymore. That's 1.5% of the people that we currently support in support employment individual placement. So we are one of those statistics of saying, hey, we don't do it. We've been doing work for 50 years. We believe in it. We're absolutely to the core. But in reality, at the rates we're being paid, we cannot do it any longer. In 2008, I was on one of the task forces that helped propose and deal with the deep recession we went into. We took $1 billion+ cuts to our system. And then noticed that at some point, our day would come back and services would get restored. There's a group of parents who are still waiting for camp to be restored because we were going to come up with a rate methodology that would allow that to happen. We're now in 2014, it hasn't happened. So if we wait for that time frame, and I am on the DC task force and on the DS task force, we're working there. We do have agreement as Undersecretary Wilkening alluded to, but we don't have a rate methodology that's sustainable yet. We can't wait any longer. We need action now. So I thank Senator Bell for his leadership, and I know his co-authors also. Thank you.
Good afternoon. My name is Richard Royce. I'm the Executive Director of InAlliance, organization here in Sacramento, but serves 8 counties within the state of California. I was struck, I'll try and be brief, but I was struck. Yesterday, I too attended the Home and Community-Based Services Committee meeting, and I'm struck that there's always conversation about direction, and what we need to know is where we're going and what will be approved or not approved. And I happened to be around when President Reagan signed the order for establishing the waiver program, what was, by the way, referred to as the Katie Beckett program. He did that when he was in Chicago, and he did that in Chicago with great fanfare about the issue of serving individuals in the community and not forcing them to come into institutions to get medical and healthcare services. So it's interesting we're talking about healthcare services and the benefit back into the community as well. In trying to express the desperation within the services, I thought I would share a story with you. A story about a woman who approached me earlier this week, actually Tuesday afternoon this week, and she came in and she's been working with us for about 10 years. And she's asking, is there really a chance that something's going to happen this year? She's one of our, frankly, best SLS staff. We're very proud of all of our staff, but she's one of our best supported living staff and has been one of those individuals that has always been there for individuals with severe medical needs and helping in that particular regard. Is there a chance? Is there hope? Is there an opportunity? Because, Richard, this year, when minimum wage hits $10, people coming into the agency will be making the same that I'm making after years of working here. That's the desperation that these people are experiencing. Please, come and see us. Senator Pan, our office is right down the street. Please come and see us. Senator Bell, really appreciate the support you've been giving us and the opportunity to meet with you earlier, as many of others. But it's truly, truly a time for action and not a time for waiting for committees. Thank you.
Hi, Carleen Holden. On behalf of Easter Seal, all the affiliates in California, we certainly want to thank the people who've really stepped forward and advocate on behalf of the people we serve and we support throughout the state. I'd also like to contribute a few things on a personal level. I have worked as an advocate for many, many years. My first job was in a state institution at the time, and I feel like I've dedicated the entire career to helping people transition to community living. And I got to tell you, we have learned a lot. We have gotten better every single year. I have a lot of faith in the department. They have experience, they have commitment, and they too are getting better and better every year. And together, I think that we can clearly do this. The successful outcomes that we're having for people who've transitioned have been very inspirational, and so it's a point of pride to be able to have dedicated that. And I look forward to a great celebration the day that we actually are able to do that. So I think the plan they're going to bring forth, I have a great deal of comfort level they'll be able to deliver it. I am concerned about the community, and I am concerned about how long it has been. I do think there's gaps in services for the people that we're all here to support, and I think those gaps have to do with if you can't get the labor to be able to do it, and they won't stay. It doesn't matter how much training you're doing if you can't do something to attract and retain workers dealing with very sensitive topics. So we appreciate those of you who have been supporting us, and we encourage all of you to continue your support. Thank you.
Thank you. Seeing no other interest in public comment, we are adjourned for the day, and I'd like to thank everyone for their participation.